Hello, everyone. Greetings from wherever you're joining us for today's webinar hosted by the Caribbean Public Health Agency and the Pan American Health Organization. The webinar entitled Guiding National Nutrition Policies and Guidelines in Caribbean Schools and Early Childhood Services, where we will be launching the technical recommendations for the development of nutrition standards for Caribbean schools. My name is Abigail Caleb, and I am the Senior Technical Officer for Food Security and Nutrition at CARPHA, and I'm delighted to be your moderator for today's webinar. We have with us today an expert panel that will present on the situation of childhood malnutrition within the Caribbean region, as well as key regional initiatives which have been implemented both nationally and regionally to prevent and control childhood obesity. During today's webinar, we will be exploring topics such as healthy school food environment, looking at the CARICOM CARPHA 6-point policy package, looking at the development process for the technical recommendations for the development of nutrition standards, as well as its key components. We're also going to hear country experience in implementing the technical recommendations. And finally, the role of our civil society partners within the school food environment. Presentations will be followed by a question and answer and feedback session where we will get to hear from you, the audience. Please use the Q&A function, which can be found at the bottom of your screen for any questions that you may have for any of the presentations. At this moment, I would like to invite Dr. Heather Armstrong, the head of the Chronic Disease and Injury Department within the Caribbean Public Health Agency, to bring opening remarks. Dr. Armstrong.
Thank you, and good morning to everyone. To our colleagues from the Ministries of Health and Education, representatives of regional institutions and development partners, and members of civil society, good morning again to you. It is certainly my privilege to welcome you to this official launch of the technical recommendations for the development of nutrition standards for Caribbean schools, and certainly is a milestone initiative that speaks directly to the health, development, and future of our region. Across the Caribbean, we are confronted with the sobering reality of childhood obesity and diet-related non-communicable diseases. They continue to rise, driven in a large part to unhealthy food environments. Our school spaces that should nurture growth and potential are not immune to these influences. Instead, they become critical intervention points where we must act decisively. And therefore, today's launch reflects a shared recognition that improving child nutrition is not optional. It is essential. It's important to safeguarding health across the life course, for enhancing educational outcomes, and of course, securing the social and economic resilience of our countries. These recommendations have been developed through a collaborative, evidence-informed process, drawing on regional expertise and global best practices. Importantly, they are tailored to the Caribbean context, recognizing our unique food systems, our culture, and resource realities. They are also aligned with the 6-point policy package for healthier food environments and food security, particularly policy point number 2 on nutrition standards in schools. And therefore, as we proceed through today's program, I encourage you to reflect not only on the technical content of these recommendations, but also on the opportunities that they present to create healthier, supportive school environments, to influence lifelong dietary behaviors, and to reduce the future burden of NCDs in our population. This is an investment in our children and, by extension, in the sustainable development of the Caribbean. I would like to extend appreciation to all partners who contributed to the development of these recommendations. And of course, I look forward to your commitment and technical leadership in terms of us being able to bring together to be at this point where we can launch the recommendations. And with that, I thank you for your presence and engagement, and I look forward to a productive and impactful session. Thank you.
Hello.
Thank you very much, Dr. Armstrong, for those rousing opening remarks and for highlighting the importance of childhood nutrition initiatives. I would ask at this time if all of the participants can please mute their microphones. And as a reminder, any questions that you may have can be placed in the Q&A function at the bottom of the chat. Please allow me now to invite Ms. Piedad Huerta Arneros, the Sub-Regional Program Director, Caribbean Acting of the Pan American Health Organization, our main regional partner in this initiative. So to bring remarks on behalf of PAHO, Ms. Piedad.
Thank you. Thank you very much, Abigail. Good morning to all the participants, and it's my honor to be in this very wonderful panel of female in this first session of the meeting. So it is a pleasure to welcome you today. We're here to talk about a topic that is both a professional priority and also deeply personal: the health and future of our children. I have 3 children and 2 grandchildren, so I really, really want to be able to transfer to them a better life with better nutrition. So we often speak about statistics or in statistics, but behind every number is a child in the Caribbean. Currently, 1 in 3 of our children or adolescents is overweight or obese. This isn't just a health trend, it is a call to action. We aren't just protecting public health, we're protecting the right of every Caribbean child to grow up healthy. Schools are unique. They are more than just a place of learning. They are environments where dietary habits are forged for lifetime. For lifetime. For a large portion of their day, children are a captive audience to the foods provided, sold, or marketed around them. The evidence from both the World Health Organization and the Pan American Health Organization is clear. Nutrition standards are not just nice to have, they are the cornerstone of a healthy school environment. They work alongside education to ensure that what we teach in the classroom is reflected in our cafeterias, in their cafeterias, and on the menu, and on their trays, and on the list of nearby vendors. WHO makes a firm recommendation. Countries must set clear rules to increase the ability of nourishing foods while reducing those high in free sugars, unhealthy fats, and salt. In recent publications, such as the WHO guideline on healthy school food environments and the PAHO review on food nutrition and physical activity initiatives in schools in the Americas, provide critical building blocks to today's debuting document. These standards define the rules of the game for cafeterias and vending machines. But for them to work, they must be evidence-informed and crucially adapted to our local food cultures and availability. We're not just importing guidelines. No. We're building a framework that fits the Caribbean context. This is why our collaboration is so vital. PAHO is proud to partner with CARPHA in developing these technical recommendations for nutrition standards in Caribbean schools. Building on the foundation of the PAHO nutrient profile model, the document we are launching today is a practical tool. It is designed to help every country in our region develop specific enforceable standards that transform the school food environments from a risk factor into a protective shield. In closing, let's be clear about our message. School nutrient standards are not about limiting choice. They are about setting a healthy default. When we align these standards with national guidance and back them with real accountability, we create a powerful instrument to reduce inequities and safeguard a child's right to nutrition. I wish you a very productive, delicious, and inspired webinar. Let's get to work for our children. Thank you very much.
Thank you very much, Ms. Piedad, for those remarks on behalf of PAHO, and particularly for stressing the importance of nutrition standards in combating childhood malnutrition, which is the central theme of our webinar. And on that note, we will now hear from our presenters. First up, we have Dr. Audrey Morris, who is the Decentralized Regional Advisor for Food Security and Nutrition at PAHO. And Dr. Morris will be presenting on healthy school food environment. Dr. Morris?
Thank you very much. And let me just share my screen. Can you confirm that you can see my screen? Okay.
Yes.
We can
All
see
right.
it, Audrey.
Yes.
We can see it.
Okay. So thank you very much. It's my pleasure to be here to be a part of this launch of this document that we have been working on with CARPHA for some time, and we're very happy to be here at the launch. This presentation is really about putting things in context. And so the title is Building a Healthy School Food Environment, which is what we're trying to do. First, let me just give you a bit of the background about the problem that we have. And this is a problem in terms of what is happening with our children and our adolescents. Going a little way back to 1975 and up to 2016, there has been an increase in the prevalence of obesity in children and adolescents in the PAHO region. So the PAHO region is the one you see at the top there, that orange color. So you'll see that we're outstripping the other WHO regions. And during that time, the prevalence of obesity in children and adolescents has increased from 3% to 14.4%. So it is an alarming situation. And to show you exactly what's happening in our Caribbean countries, you'll see them highlighted there. And this is the chart showing the prevalence of overweight and obesity among children and adolescents from 5 to 19 years. Overweight being, of course, BMI equal to or above 1 standard deviation above the median, and including obesity. So this is overweight and obesity. And we're seeing that in the top 8 countries, we have 5 of our Caribbean countries who are in that top quintile, and others where the situation might not be as alarming, but it is still something to be worried about. So we know that overweight and obesity is a problem or are a problem in our countries among school children. Because of this, we had to do something. So PAHO developed this plan of action for the prevention of obesity in children and adolescents. You'll see there that the time frame was 2014 to 2019. So while it was a 5-year plan, we are still monitoring what countries have done in enacting this plan. The goal of the plan was to halt the rise of the rapidly growing obesity epidemic in children and adolescents. There were 5 strategic lines of action, including primary health care and promotion of breastfeeding and healthy eating, fiscal policies and regulation of food marketing and labeling, other multisectoral actions, surveillance, research, and evaluation. But the second one there, the improvement of school nutrition and physical activity environments. So this plan had a specific line of action in terms of school nutrition. The activities there, or the objectives, were to ensure that national school feeding programs and the sale of food and beverages in schools should A, comply with the norms and regulations that promote the consumption of healthy foods and water, and prevent the availability of energy-dense, nutrient-poor products and sugar-sweetened beverages. The second objective was to promote and strengthen school and early learning policies and programs that increase physical activity. So as you see, the problem was of such import that there is a whole plan that was developed. And while the time frame that was originally planned has expired, we still monitor what countries are doing. So you'll agree that schools are a unique platform to improve the health and nutrition of children. When you tot up the time, children spend about 6 to 8 hours daily at school, and this is for around 9 months of the year, for at least 10 years of their lives. So the interventions in schools allow the introduction of changes in eating habits, and prevents overweight and obesity. It allows long-term interventions and sustainable change. You get the opportunity to reach out to families and communities. You can institute school feeding programs, and they develop, as you said, the knowledge, attitudes, and life skills that children will have for life. Just a little note here, school does not cause hunger, but it can cause obesity. Now, PAHO has recently published a document, Food, Nutrition, and Physical Activity Initiatives in Schools in the Americas. This presents a regional compilation of the initiatives that help create sustainable environments for children and adolescents who, as we said before, are the future generation. So of the 29 countries that we had information for, with some component related to the physical environment of schools, these were the Caribbean member states that had a school health and nutrition policy, program, or standard. So we have there Antigua and Barbuda, Bahamas, Barbados, Belize, Grenada, Haiti, Jamaica, Suriname, and Trinidad and Tobago. So with the with the launch of these standards, we do hope that that list will be extended. WHO in 2025 also published an important document. This is a WHO guideline on policies and interventions to create healthy school food environments. And there are, of course, the recommendations that come from that guideline. First of all, there's a good practice statement that the foods and beverages provided, served, sold, or consumed at schools should be safe and should contribute to healthy diets. And what are the foods that contribute to a healthy diet? The nutrient-dense foods, which are rich in the naturally occurring fiber and or unsaturated fatty acids, low in saturated fatty acids, trans fatty acids, free sugars and salt, free of non-sugar sweeteners, and the consumption of the foods that contribute to a healthy diet is associated with positive health outcomes. The next recommendation is on food provision at school. Countries should use food provision at school to increase the consumption of foods and beverages that contribute to a healthy diet. So this refers to the foods and beverages provided as meals or as snacks at school, whether it's provided free of charge. Is it a part of school feeding, for example? Is it at a reduced price or at full price, and whether provided universally or in a targeted manner? In all those circumstances, it should be foods that contribute to a healthy diet and should be in line with nutrition standards or set rules. And also, for each country, the foods provided should be based on dietary guidance, including the food-based dietary guidelines that most of our countries in the Caribbean already have. The next recommendation is perhaps while we're here, set and use nutrition standards or rules to increase the availability, purchase, and consumption of at school of foods and beverages that contribute to a healthy diet. And on the other hand, decrease the availability, purchase, and consumption of the foods and beverages that do not contribute to a healthy diet. Or so nutrition standards or rules then are needed to specify which foods and which beverages are allowed or not allowed to be provided, served, or sold at schools. Usually, nutrition standards or rules may be implemented through mandatory legal instruments to regulate the food environment in the school, yes, but there are ways, I want to point out, of extending this to the vicinity of the school. So extending their impact beyond the school premises. Because very often we hear that you might be doing a lot at school, but when children see other things being offered on the way to school or around the school gate, there needs to be some standards which are in play there also. And there are ways of doing that. WHO also made a recommendation on nudging interventions. So these are interventions that they're recommended to modify the school environment at school to increase the selection, purchase, and consumption of foods and beverages that contribute to a healthy diet. So the nudging interventions are not by themselves, but they are part of a comprehensive package of the school food and nutrition policies and intervention. So nudging can be, for example, changes in how the foods are presented or positioned. If you're promoting the consumption of water, for example, where are students going to access water? Is water available for them, whether from the tap or coolers? So water coolers can be strategically placed, or if it is that they have to buy bottled water, it should be available, a place where they can see it and request it instead of at the bottom of the fridge or at the back of the tuck shop. Okay. Another nudging intervention also is the provision of nutrition information about school. Let children see the menus and what is in the foods that they are eating. In developing the standards, as you will hear, the technical recommendations for the use in nutrition standards, we have used the PAHO nutrient profile model. And this booklet that you see there, it has criteria for identifying the processed and ultra-processed products, excessive in sodium, free sugars, other sweeteners, saturated fat, total fat, and trans fat. So these are the limits which we have been recommending for some time, and which you see at the bottom there, you see each of these is linked to a WHO guideline or recommendation. So for instance, the content of sodium in foods offered at school should not be more than 1 milligram of sodium per kilocalorie energy. Okay. That is the criteria. And so for the others that you see listed there. We have also used in developing the guidelines the recommended nutrient intakes and population nutrient intake goals for the Caribbean. And these were published in 2020. In doing so, we have different age groups, and you'll see in the guidelines, in the technical recommendations when they are presented, that the age group categories 4 to 8 years old, 9 to 13 years old, and 14 to 18 years old. The RNIs are already presented to you, and those are what we have used in the technical recommendations. All right, so we're talking about building a healthy school environment. What's the evidence for this? There's a whole lot of evidence for the creation of healthy environments for nutrition. So what we're working towards, increasing the availability of healthy foods and beverages, and simultaneously reducing the availability of unhealthy foods and beverages. There is evidence that there's positive effects on outcomes using school lunch standards and restrictive policies. There's evidence that the provision of school food has a positive effect, especially in low income and disadvantaged settings. And the provision of school food there refers to school feeding programs, school lunch, school breakfast, and provision of fortified foods. Also, the provision of fruits and vegetables in schools increase children's consumption. We have had, even in the Caribbean, in projects that we have had, by providing fruits and vegetables to children in a way that is pleasing to them, it increases the likelihood of them eating it. And we found also that the children would go home and look at their plates and say, why are no vegetables on my plate? So they would ask for vegetables after it was introduced to them at school. All right, so in summarizing, the healthy school environment then has the application of nutrition standards as well as the food-based dietary guidelines to all foods available in school settings. There's the elimination of marketing of food and non-alcoholic beverages. So these foods should not be promoted in schools. Any setting where children gather should be free of the promotion of these unhealthy foods. The regulations that we are advocating to countries to set should be applicable to school meals, so food service area, whether it's a canteen, cafeteria, whatever the area is, your vending machines, tuck shops, snack bars, and the food available around the schools. Extend your standards there. The enforcement of standards along with the capacity building is a prime priority in promoting healthy food environments in schools around the world. And I'm showing you here, finally, some of the resources that are available. If you visit the PAHO website, you will see that there are some resources here available for school nutrition policies and standards. And I thank you for listening.
Thank you very much, Dr. Morris, for outlining the situation of childhood nutrition or malnutrition within the region, as well as those initiatives which are spearheaded by PAHO in combating childhood obesity in particular. Please allow me now to introduce or reintroduce some of you to the 6-point policy package. In fact, I will be making 2 presentations. The first will focus on an outline and update on the 6-point policy package. And the second, I will be going through the development process for the technical recommendations for the development of nutrition standards for Caribbean schools, as well as outlining the key components of the technical recommendations document by way of a video. So, 6-point policy package. So for there may be those of you who perhaps are not aware of this important regional initiative by CARICOM and CARPHA to combat childhood obesity. So by way of a video presentation, I will introduce you to it, and following which I will provide some key regional updates that have been achieved by CARPHA, CARICOM, and our regional partners.
The Caribbean region is one of the worst affected by chronic non-communicable diseases like high blood pressure, heart diseases, diabetes, and cancer. In 2017, CARPHA implemented the 6-point policy package, a regional framework to promote healthier food environments and food security to address childhood obesity and NCDs through joint policy action. The 6-point policy package contains a set of policy options under 6 policy areas.
The objective of policy point number 1 is to enable consumers to make informed food choices and to prevent misleading claims about nutrition and health benefits. There are 4 policy options on the policy point number 1. These are 1. Mandatory uniform nutrition facts panels on all packaged foods and beverages. 2. Standardized graphical nutrition labels on all packaged foods and beverages. 3. Regulate marketing on the package of all foods and beverages. 4. Mandatory nutrition labeling on menus and menu boards. The objective of policy point number 2 is to ensure that food provision in schools and all government-funded settings are aligned with dietary guidelines. This calls for mandatory national nutrition standards for all foods provided and sold in schools and all other public institutions.
The objective of policy point number 3 is to reduce the impact of the promotion of unhealthy foods and beverages to children. To achieve this objective, we recommend regional guidelines to reduce children's exposure to unhealthy food advertising across all channels. The objective of policy point number 4 is to minimize the energy density and the unhealthy composition of prepackaged and ultra-processed foods. There are 3 policy options under policy point number 4. These are 1. Mandatory removal of artificial trans fats across all food products. Number 2. Regional standards and targets for the reduction of salt, fat, and sugar that are time-bound. And number 3. Improve the nutritional quality of ingredients and food sold from street vendors and food service outlets.
The objective of policy point number 5 is to protect food sovereignty and to promote healthy domestic food environments. This calls for selectively adjusting sales taxes and import duties on foods and beverages, as well as tailoring public assistance to encourage healthy food consumption. The objective of policy point number 6 is to improve local availability and appeal of healthy foods, especially fruits and vegetables. To achieve this objective, policy options include providing incentives for farmers and local food producers, promoting the use of healthier ingredients, and promoting and supporting school and community gardening.
The implementation of the 6-point policy package is monitored by an interagency technical committee, as mandated by the CARICOM Council for Trade and Economic Development and the Council for Human and Social Development. This ensures transparency and accountability. CARPHA and its partners stand ready to continue to support countries in the implementation of the 6-point policy package, all to combat unhealthy food environments and reduce the burden of overweight, obesity, and chronic non-communicable diseases in the Caribbean region.
And there we have our 6-point policy package. But what are some of the work that has been done towards achieving the objectives under each of those policy points? Confirming that you're able to see the presentation?
Yes.
Yes.
Wonderful. So update and implementation of the 6 PPP. Policy point 1, food labeling. The lead agency being the CARICOM Regional Organization for Standards and Quality. And much of the work around this policy point has been in promoting nutritional labeling standards or enabling nutrition labeling standards. So CARICOM would have revised the draft regional standard for labeling of prepackaged foods. There were 2 rounds of voting within CARICOM member states in 2023 and 2024. Unfortunately, in the rounds of voting, approval was not given for FOPWL, front of package warning labels, to be included. So what are these and why was it or is it considered important? Imagine a packaged food and without having to go to the back of the label and look at the nutrition facts panel and to determine percentage daily values, you can see right to the front of the label whether it is high in sugar, fats, saturated fats, trans fats, or sodium. Wouldn't that make it easier for you to make a healthier and informed choice? And this is what CARPHA, CARICOM, the Healthy Caribbean Coalition, CrossQ, CARICOM, all of the regional partners have been promoting. Unfortunately, after 2 rounds of voting in member states, this was not adopted. However, recognizing there still is a need to have a nutrition labeling standard for foods imported and exported in the Caribbean region, the standard was allowed to move forward with the FOPL annexes removed, which are based on the PAHO nutrient profile model. This revised version was approved by the Council for Trade and Economic Development in 2024. And from then to now, work has continued in terms of having several regional consultations and proposals to see how FOPWL can still be implemented within the region, even if it's by means of a separate policy. So apart from the work that CrossQ has been leading on in terms of development of this regional standard, the basis for FOPWL, or why there was such strong conviction and advocacy around it, it is because there are several studies that shows that it's the most effective food labeling system to help consumers to correctly, quickly, and easily identify foods that are high in unhealthy ingredients, fats, sugars, and salt. But one of the criticisms was that the studies were not, Caribbean based, they were not regional. So with the support of PAHO, 2 studies were conducted, one in Jamaica in 2021 and the other in Barbados in 2023, that showed the effectiveness of FOPWL. In fact, in the Barbados study, it shows that the octagonal shape front of pack warning labels, that these have the potential to prevent 16% of deaths caused by non-communicable diseases in Barbados, and that would save the country around $732.8 million US dollars. So it definitely it would be the best choice. Apart from these studies, there have been lots of advocacy work which has been led by the Healthy Caribbean Coalition, our main civil society organization. For instance, there was the Better Labels regional campaign in 2021 and 2023, both to coincide ahead of the member state vote. And also there have been several sensitization and awareness sessions, such as regional webinars, done in collaboration, in the collaborative approach, CARPHA, PAHO, Healthy Caribbean Coalition, and some other of our regional organizations. But we are not discouraged. We know that there are reasons why the FOPWL was not implemented, and it is not because of a lack of desire on the part of governments for a population to be healthy. And we're aware of what the constraints are, and we will continue as a regional agencies to continue to fight for what is best in terms of promoting health for the people within the Caribbean. So you'll hear more on this policy point. The second policy point, nutrition standards and guidelines for schools and other institutions. So the lead agency is CARPHA, and you will shortly hear about the work that we have done with PAHO in terms of developing the technical recommendations for the development of nutrition standards for Caribbean schools just last year. In addition to that, there's direct and ongoing country support, which is offered to our member states in terms of developing and the policies and also advocating for school nutrition policies, standards, and guidelines. The third policy point, food marketing. So the lead agency here is PAHO, and there has been a concentrated regional action on marketing or sales controls within our schools. In particular, there are several legislative guidance documents which have been developed so as to guide countries towards developing and enacting not just policies, but also legislations, having it in law, so to control the school food environment, marketing within the school food environment. So there's several countries that have, because of this, that have banned sugar-sweetened beverages or restricted sugar-sweetened beverages within schools. Just to name a few: Barbados, Belize, Bermuda, Trinidad and Tobago. Several other countries are currently in that process. But I just wanted to make a note of in the Barbados policy. So the banning of the SSB was actually incorporated within their school nutrition policy. So it doesn't allow for sugar-sweetened beverages, sports drinks, candies, confectionaries. These are now not allowed to be sold or served within the school environment. So when we speak of creating an enabling environment, it is more than just talk, but we are actively trying to, CARPHA, HCC, PAHO, all of our partners, we're trying to put it into action to make the healthier choice, the easier choice for our consumers, and in this instance, our children. In addition to that, for food marketing, there's also been several regional advocacy campaigns spearheaded by the Healthy Caribbean Coalition. So of note, there was the digital campaign Acts and Facts, the Food in Schools Matters, in 2022, and it was rerun in 2025. And this was to encourage public and policymaker support for introducing policies that limit the sale and marketing of unhealthy products within schools while promoting healthy foods as well as water. This brings me to the fourth policy point: nutritional quality of food supplies, levels of harmful ingredients, looking specifically at the levels of fats, trans fats, saturated fats, total fats, sugar, and sodium. Now, there has been a concentrated effort within the region in terms of eliminating polyhydrogenated oils, which are industrially produced or processed fats that are the main source of trans fatty acids, which have been linked to several adverse effects of particular cardiovascular diseases. And our CARICOM policymakers would have committed to eliminating the polyhydrogenated oils or trans fatty acids by December 2025. So some of the work that was done towards this objective, even though we have not achieved it, so there were several workshops that were conducted with key persons within key ministries in terms of developing policies and drafting regulatory tools. There was also a regional advocacy campaign and a social media campaign. And so the challenge here, where in not accomplishing this goal, it is certainly not from a lack of desire or from effort, but one of the significant challenges is a lack of laboratory testing capacity to ensure that when these laws, for instance, are enacted, that countries are able to test the foods that are coming into the borders and that are being produced within the country. So recognizing this gap, you'll be hearing in the future more on this policy point in terms of how this particular challenge is being addressed. All right. So for policy point 5, trade and fiscal policies, the lead agency CARICOM and the CARICOM Single Market and Trade, formerly known as the Office of Trade Negotiation. So much of the support to countries has been towards developing and implementing policies and legislation on adjusting sales taxes on foods. So you might have heard of the SSB or sugar sweetened beverage tax, which have been implemented in at least 6 of our of CARICOM member states. And the final policy point, food chain incentives. Here the lead agency is CARDI, Caribbean Agricultural Research and Development Institute. So much of the work has been towards having a strong alignment with food security agendas through CARICOM 25 by 2025, now 2030, and related food strategies. So just to point out, 2 such examples from member states towards achieving this. So in Bermuda, they implemented duty reductions for some fruits and vegetables alongside the sugar tax package. And in Guyana, subsidies are given on local fruits and vegetables to farmers. And I would be remiss not to mention the Resilient School Feeding Program, considering that we are launching nutrition standards for Caribbean schools. So this was a project that was led by CARDI in collaboration with the Food and Agriculture Organization and the Inter-American Institute for Cooperation and Agriculture. And it had 3 main components. So one was to train farmers to strengthen their capacity to meet market demands. The second was to promote climate smart school gardens. And the image in this slide actually is from an expo where students themselves they were managing the booth in terms of displaying some of the produce that they grow and how they're able to do so using smart agricultural initiatives or techniques, such as hydroponics. And the third component, of course, was nutrition education being incorporated, that whole farm to fork concept. And so these are the 6 policy points and the key updates under each of the policy points. The document can be accessed at these links, which will be shared at the chat. And I will ask any questions that you have, if you can please place them in the Q&A function at the bottom of your screen. My second presentation will be on the technical recommendations document, and I believe the reason why we're all here today. So if you allow me to share my screen. So confirming that you're able to see the slides?
Yes, we can.
Okay, wonderful. Thank you. So overview of the development of technical recommendations for the development of nutrition standards for Caribbean schools. Now this is placed quite nicely. It aligns quite nicely with 6-point policy point 2, nutrition standards and guidelines for schools and other institutions. You might recall from the video that there are several policy options on each of the 6 policy points. So on the policy point 2, for instance, policy option 2.1 is to have mandatory national nutrition standards for all foods provided and sold in schools and early childhood services based on a generic or regional guideline. And this approach, the objective would be to ensure that the food provision in government-funded settings encourages dietary choices that are aligned with dietary guidelines. And this particular policy point and policy option are deemed as very critical in terms of achieving several of our regional initiatives, such as the Port of Spain Declaration of 2007, as well as the World Health Organization Global Monitoring Framework indicators around non-communicable diseases. And of course, we know that school feeding programs and school feeding generally, school nutrition generally, they provide an excellent opportunity to influence children's food tastes, their preferences from an early stage in life that will then help to promote healthier eating habits later in life. Not to mention that there's several studies around the effectiveness of targeting children in terms of promoting healthier eating habits, creating an enabling food environment. Right. So you may notice me going through some of the points. Not to worry. The presentation will be shared. But I should say I'm very eager to get to the reason why we're all here, which is the technical recommendations document. So before I share that video in terms of what are the key components, let's just briefly go through the development process. So CARPHA and PAHO would have held several consultations with technical experts from key ministries such as health, education, and academia within several of our member states, namely Trinidad and Tobago, St. Lucia, St. Kitts and Nevis, Dominica, St. Vincent and the Grenadines, Jamaica, Grenada, and Antigua and Barbuda, right? So coming out of these consultations, the first draft was actually developed in 2019, the end of 2019. But what happened in 2019 or going into 2020? The COVID-19 pandemic. And unfortunately, school nutrition was just not a priority. So it wasn't until December 2024 that the draft was actually finalized. The co-publishing agreement between CARPHA and PAHO was then finalized in September 2025, and immediately we started implementation in the November 2025. So this implementation was done by means of several in-country workshops. So we had workshops in St. Lucia, Dominica, St. Kitts and Nevis, Antigua and Barbuda, and Grenada, starting initially with some of those countries that would have been a part of the process. And so, of course, we're keen to benefit from the results or the fruits of it. The goal of these workshops were to support the implementation of the technical recommendations in order to develop or strengthen national nutrition standards for all foods provided and sold in schools and early childhood services. So participants were drawn from ministries of health, education, agriculture, youth, international trade, as well as civil society. So as wide a variety as possible of stakeholders within the school food environment. Also in December 2025, the technical recommendations were actually published, and we are now here for its launch. It can be accessed via these two links, which will also be shared in the chat. But now allow me, by means of a video presentation, to introduce you officially to the technical recommendations document and what it has to offer and how it will be a key resource within the Caribbean region towards guiding the development, implementation, and monitoring of national school nutrition policies. The region is one of the worst affected. The Caribbean region is one of the worst affected by overweight and obesity, affecting every 1 in 3 Caribbean children. Among the leading causes of overweight and obesity are unhealthy diets. Several initiatives have been implemented both nationally and regionally to decrease access to and consumption of unhealthy foods among children. In 2017, the Caribbean Public Health Agency, CARPHA, implemented the 6-point policy package, 6PPP, a regional framework to promote healthier food environments and food security to address childhood obesity through joint policy action. The 6PPP contains a set of policy recommendations under 6 policy areas. Policy Point 2, Nutrition Standards and Guidelines for Schools and Other Institutions, strongly recommends the development of mandatory national nutrition standards for all foods provided and sold in schools and early childhood services based on a generic sub-regional or Caribbean guideline. In 2025, CARPHA and the Pan American Health Organization jointly developed technical recommendations for the development of nutrition standards for Caribbean schools. The technical recommendations aim to 1. Create enabling environments in schools which increase access to a range of healthy, nutrient-dense foods. 2. Reduce the consumption and availability of foods and beverages high in unhealthy fats, sugars, and/or salt or sodium. 3. Promote healthy eating habits among school children that contribute to reducing childhood obesity and preventing malnutrition in all its forms. These technical recommendations apply to all foods and beverages served in schools, whether cooked or packaged, prepared on or off-site, and sold or free of cost. They should be used to guide recipe development for prepared food items, as well as to determine whether a processed or ultra-processed product is suitable to be sold or served based on the PAHO nutrient profile model. The technical recommendations provide guidance on a wide range of areas. 1. Guidance on determining nutrient and meal standards for schools, including recommended energy and nutrient intakes for children 4 to 18 years old. Example of lunch meal plans for children 4 to 8, 9 to 13, and 14 to 18 years old. Examples of exchanges to portions by age group. 2. Technical recommendations for school nutrition, in which foods are grouped into 11 categories. The technical recommendations document also provides criteria for prepackaged, processed, and ultra-processed foods based on the PAHO nutrient profile model, as well as criteria for meals prepared from fresh foods and mixed ingredients. Countries are encouraged to tailor these lists to include or exclude foods which should be available to students at schools in their countries. 3. Other recommendations for school food service, such as safe food handling and hygiene, media and marketing, sponsorship. 4. Preparing national guidance for food providers. The technical recommendations document contain general guidelines or subject areas for food providers. 5. Roles and responsibilities of key stakeholders in the school food environment. CARPHA and PAHO strongly recommend that countries fully adopt these guidelines to develop national guidance for food providers in Caribbean primary and secondary schools. Schools present a critical tactical avenue to influence child dietary behavior at a population level. As such, the technical recommendations for the development of nutrition standards for Caribbean schools will be an indispensable resource for regional, national, and local school food providers and policymakers towards ensuring that our Caribbean children are among the healthiest.
And there you have it, the technical recommendations
Now, I would remind you all, any questions that you may have for any of the presenters, you can place it in the Q&A function in the chat, and we will respond directly to your question within the chat. Please now allow me now to hear from one of the countries that would have benefited from the training last year. So I will now like to introduce Ms. Samantha Moet, who is the Chief Nutrition Officer within the Ministry of Health, Wellness, and the Environment of Antigua and Barbuda, to present on the use of the technical recommendations in guiding the development of a national school nutrition policy or guideline, the Antigua and Barbuda experience. Ms. Moet?
Good morning. Thank you, Abigail. Please allow me to share my screen. Just give me one sec. Right, I think I'm ready now. Please indicate that you're able to see the screen.
Yes, we are in present view.
Perfect, thank you. Good morning or good day again to all. And my name is Samantha Moy, Chief Nutrition Officer in the Ministry of Health of Antigua and Barbuda. This morning, I am pleased to be sharing the Antiguan experience, and I thank CARPHA, particularly Ms. Caleb, for inviting us to share what we've done so far with the rest of you. So, just in terms of a background, so last year, as Abigail had mentioned, last December, Antigua, along with the Ministry of Health, along with CARPHA, hosted the School Nutrition Standard Workshop in December of 2025. Coming out of that meeting, we were able to establish a steering committee to guide the development of our own national school nutrition policy. And from since then, we've had monthly meetings beginning in January 2026. With regards to the composition of the committee, so from the Ministry of Health, we have the Chief Medical Officer, we have Senior Nutrition Officers, the Non-Communicable Disease Department, the consultant, the coordinator. We have a representative from Health Promotions, as well as a representative from the Medical Benefits Scheme. We also have our community pediatrician on board with us from the ministry side. From the Ministry of Education, we have our advisor to Health and Family Life Education, and we also have a representative from the National School Meals Program so far. We did involve civic organizations such as the Antigua and Barbuda Diabetes Association, the National Parent Teachers Association, Heart and Stroke Foundation so far. And with regards to youth and student representatives, we also have included our CARICOM Youth Ambassador, as well as we've invited school council reps to be a part of our team. So that is the makeup of our team so far. With regards to external collaboration, our country program specialists organized a meeting, a joint meeting with the Barbados team. This was an important meeting for our country because we're trying to establish our own policy and wanted to look at how other countries were able to accomplish this. So PAHO was able to set up a meeting with the Barbados team who were responsible for developing and implementing their school nutrition policy. Coming out of that meeting, and that was held in February of this year, we were able to learn from the Barbados experience, especially the importance of early collaboration with the stakeholders, and also identifying designated champions at every level. So not just at health or education, but also within the community and within the schools as well. And lastly, the importance of monitoring and evaluation once these policies are in place. With regards to our work plan, just to, let you know that we're just starting out. So we're just a couple of months into our work on this policy. And we decided that we wanted to focus currently on what we call the low-hanging fruit. So some of the things that we have been focused on recently is the collection of relevant country data to help to build our situational analysis. Also, the relaunch of Water Wednesdays in schools and a phased approach to banning sugar-sweetened beverages in school. I'm going to go through each of them. So with regards to the collection of relevant country data, there's some things that we had already and, we are trying to pull out because we know this is going to become important, especially when we go to the public, when we're setting up the policies. So things such as the rate of overweight and obesity among children. And we would have done a study with IAEA last year on body composition in 8 to 11-year-olds, and we are already seeing a 1 in 4 rate of overweight and obesity among that age group in the schools that we have chosen. The other things in terms of relevant country data that we want to look at is the data on school beverage and food environment. So we are, as part of the committee, what we're doing is setting up a sheet so that we can get an idea of what is being sold and available at schools. In addition to that, we are going to be also working on establishing mapping of what is available in country as relates to SSBs, which I'll talk a little bit more about. In addition, we do have National School Meals Program in Antigua. So we're getting background information in terms of how many meals are sold, are served, and the types of meals that are on the menu so we can start breaking that down a little further. The relaunch of Water Wednesdays. So Water Wednesdays was established several years ago with the Ministry of Health's Health Promotion Department along with the Ministry of Education. However, what we have found is that at present that only some schools are doing it or enforcing it. Our goal is to try to have all schools on board for the upcoming school year, the 26-27 school year. And how we intend to do this, we want to have launch a media campaign just before school reopens in September that will speak to the importance of water and the dangers of using alternative beverages, especially the sugar-sweetened ones. In addition, we are doing an assessment of the water available in school. And I know Dr. Morris spoke to this as well in her presentation, the importance of knowing what water is available. Are there water fountains? Is there, sale of bottled water in the schools? Can children or students have easy access? So that is one of the things that we'll be doing leading up to this, so that we can have well established when we start the media campaign and also when we start speaking directly with the schools. With regards to the phased approach to the banning of SSBs in schools, as a committee, we have started discussion about this. So in Antigua and Barbuda, we do have an existing sugar-sweetened beverage policy that has not yet been implemented. This was approved by Cabinet back in 2023. And as a part of this policy, it speaks to the banning of the sale and marketing of sugar-sweetened beverage in and around schools. So what we thought that we can do in the meantime, remember we're thinking low-hanging fruit, is that, and also thinking phased approach, is that we can start with banning or limiting the sale and availability of sodas in the upcoming school year. And because we already have this policy, approved policy, we're planning to use that as our crutch for getting this done. However, leading up to that, some of the things we're looking to do, and we've already started, is to create to complete a mapping of the sugar sweetened beverages that are sold in and around schools, also what is easily available on the market. Now, using those beverages, the plan is to compare it to what the PAHO nutrient profile model recommends, so that when we go and do our consultations with the vendors, the principals, the teachers, the parents, that we can have something to show and to compare, where we're going with this and why it is necessary in terms of the amount of sugar in these drinks. Another approach here is our plan is for in July, after the school year has closed, is to invite the school vendors, those that run canteens, those who have tuck shops around the schools, to a training or meeting to discuss this. So definitely involving them from early so that they know where we're going with this. So that is our plan for the phased approach for the banning of specifically sodas to begin with in schools. With regards to our next steps, so well, I'm from the Ministry of Health, and of course, this is a collaboration with, especially the Ministry of Education. So even though, yes, we would have had meetings with education, we want to now formally put forward our proposal for the upcoming school year. So we plan to do that by this month, the end of this month, to clearly outline our steps for the next couple of months, and especially with regards to the Water Wednesdays, and looking at the restricting the sale and marketing of SSBs, specifically sodas in the schools. The other thing is that our committee will continue to meet monthly to support the current actions that we have decided to take. And finally, just hoping, as we take these small steps to get towards a national school and nutrition policy, that, we will get external help in actually drafting the policy, but we're just doing some of the background work now so that, when we start putting our policy together, that we will have already established things in place. And that ends my presentation. Thank you very much.
Thank you very much, Ms. Moyet, for sharing the progress of Antigua and Barbuda following the training conducted just in December 2025 in the use of the technical recommendations document. And I'm sure that this will be an encouragement to those countries who are currently in the process of developing their own national school nutrition policies or guidelines. We now have the pleasure of hearing from our civil society partner. Please allow me to introduce Ms. Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition, to present on the role of civil society in the school food environment. Ms. Hutton?
Thank you, Ms. Caleb. And I'm conscious of the time, so I'm going to fast track my presentation so that we can end relatively close to the initial end time. So this is really the role of civil society. What have we done to date, and how can we support the implementation of these technical recommendations? So we bucketed the kind of role that we've played into 7 key areas, and I'm going to share across these key areas what HCC has done and what many of our partners on the ground in country have done. So creating frameworks for joint action, I just wanted to take you back to 2017 when HCC developed this framework for addressing childhood obesity. And the framework mapped out a number of key areas, including addressing the school food environment, in particularly removing ultra-processed products from schools. And this is including the sale and marketing of these products. And in 2023, we had a regional meeting where we brought together all sorts of stakeholders. Many of you who are on the call and on this presentation attended this meeting, and we created a roadmap, and we've since been implementing that. We work with a number of partners. This work can't be done in isolation, global partners, regional partners, and national partners, including local ministries of health, education, and civil society organizations. Engaging with key stakeholders as part of that partnership, and these are examples from in country. This is from Barbados, working with manufacturers, beverage processors, and distributors, ensuring that the foods that are sold and available in the schools are compliant with the national school policy, working with that key group of vendors, hosting training sessions, and this is a series of training sessions that have happened in Barbados. Connecting with policymakers. This is the Barbados Childhood Obesity Prevention Coalition with the Minister of Education. This is in Jamaica. This is the Heart and Stroke Foundation, the Jamaica Youth Advocacy Network with the Minister of Education there just shortly after the school nutrition policy was approved. So really bringing in stakeholders and working with them in a targeted and tailored way. Building coalitions at the regional level and at the national level. This is a coalition that was really mandated or called for out of that 2023 meeting. This is our Regional School Nutrition Policy Network. It consists of members from across these member states, ministries of health representative, education representatives, and civil society, really bringing together actors to ensure that we can learn from the experiences similar to what you just saw in Antigua that Samantha explained, and also bringing together regional partners so that we have the regional work really also influencing what's happening at the national level. And this is an example of a really powerful coalition that has emerged over the years in Barbados, the Barbados Childhood Obesity Prevention Coalition, that's really leading a lot of the work. And you can see here, this is a diverse coalition, not the usual actors. So really bringing in diverse voices around this unified voice, and in this instance, around school nutrition policies. And then developing evidence, developing tools, and supporting capacity building. This is a tool developed by the HCC a few years ago, model legislation and guidance, again, very focused on restricting the marketing and availability of ultra-processed products in schools. This is a model that was developed in Barbados as they really tried to develop proof of concept around this idea of regulating and removing SSBs from schools and having really robust school nutrition policies. This is the Caribbean Institute for Health Research, highlighting the importance of data and working with our academic partners to drive the decision-making. In Barbados, this is a tool that they developed, a really critical tool that was developed and led by the Heart and Stroke Foundation of Barbados. Once the school nutrition policy was introduced, the question was, how do we alert the public? How do we alert the administrators in schools? And how do we alert the private sectors what snacks and beverages are actually compliant within the school nutrition policy? And this is a snack list that has been updated every year. It's available publicly online, and it's really helped to kind of support the implementation. And again, working with vendors, providing tools, building capacity. Another piece, which is really important for the work that we've been doing, you would have seen from Ms. Kayla's presentation, around this idea of building public support and demand for these policies. So we've implemented a number of regional campaigns, and you would have seen some of those earlier. I wanted to point out a recent summit, again held in Barbados, the World Obesity Youth Summit. This was bringing together partners. And I want to point out to the bottom here, this is Ministry of Health, Ministry of Education, and civil society, and the Childhood Obesity Coalition, bringing together partners around this idea of addressing the school food environment. Again, campaigns at the national level. This is in Barbados, this is in Jamaica, and this is building public support again through this campaign and launching that campaign in partnership again. So again, this idea of partners, bringing together these joint partners in these initiatives. Engaging youth. Now, youth are the key beneficiaries, and they are therefore driving and at the heart of this change. And this is this cool schools tour image from Barbados. And they just celebrated a major milestone of 100 tours across schools in Barbados, building awareness among young people about the school nutrition policy, why healthy eating is important to them, and really getting them on board and creating buy-in at the level of the young people in schools. Using youth voices to speak about issues, oftentimes challenges in implementing school nutrition policies. This is around the marketing piece. And this is, again, using that youth voice. This is from Jamaica, the Jamaica Youth Advocacy Network. This is an accountability, really calling on the government. Hey, you got this. This has been approved by cabinet. Let's now work together to roll this out. So youth have been a really powerful voice. And on this issue of youth too, the Youth Hope for the Future is an initiative established by HCC. We're in our third year now, and it's really around bringing together CARICOM member states led by youth, but working with all sorts of partners at the national level around an initiative which really, again, calls for healthier school nutrition policies. And we are in the preparation process right now, and hopefully we'll reach out to many of you to support this initiative over the coming months. Monitoring is an important piece, and you've heard about that. So civil society has an important role to play in joint monitoring. We have a watchdog role, and that's part of the role we play. HCC has something called the Childhood Obesity Prevention Scorecard, which you can see online, which monitors a range of childhood obesity prevention related policies in addition to school nutrition policies. And then here you'll see on our website, we also have trackers, including the WHO Progress Monitor, which PAHO has condensed for our region, as well as the Port of Spain grid. I wanted to point out here again an example from one of our countries. This is Barbados again, and they are working with the Ministry of Education to develop an app to support monitoring the school nutrition policy. Accountability is another role, which, touched on this, and how do we hold ourselves? How do we work with the governments to support the implementation of the school nutrition policies? This is a campaign we had where we were highlighting, one of the gaps and challenges we've had is this piece around marketing, and how do we, even though we have robust school nutrition policies, the marketing often continues. So this is, using public education to highlight these weaknesses and really hold accountability. This is in Jamaica, calling for implementation of the school nutrition policy. You'll see almost 300 young people sign this. This is a recent op-ed from a young person saying no more junk food should be dumped in schools. And in Barbados, there was a recent statement again around the marketing piece, but bringing together actors, really emphasizing the importance of this accountability piece. So wrapping up now, what can civil society do in supporting the implementation of these technical recommendations? Well, in addition to those areas, one of the key areas that we need support in is capacity and resources. You'll have heard me reference Jamaica and Barbados repeatedly, and these countries have had the benefit of resources to fund these types of initiatives. So we really need to engage and invest in civil society so they're fit for purpose and able to play this role. We need to sensitize them, read the technical recommendations, and CARPHA and PAHO have been doing a brilliant job, and that's why I put this image here from St. Kitts and Nevis, a recent school nutrition policy meeting hosted by the Ministry of Health and Education, where civil society was engaged and involved and included. And once they're engaged and involved, they can then act as champions, and they can work with the community and bring together all of those various actors. They include them in the implementation, where we've seen successes where they're included in the implementation committees, and then also partnering to build awareness and working with key groups, most importantly, centering youth voices. And with that, I think I'm about a minute and 30 seconds under time, so I hope that helps with the timing. Thanks very much.
Thank you very much, Maisha. So surely we see from that presentation the critical role that civil society organizations play both nationally and regionally in terms of supporting ministries of health and education in implementing and monitoring policies around the healthy eating within the school environment. So you've now heard from us, representatives from the Pan American Health Organization, the Caribbean Public Health Agency, the Ministry of Health, Wellness, and the Environment of Antigua and Barbuda, and the Healthy Caribbean Coalition. We've presented on the problem of childhood obesity and on national and regional initiatives to combat it. Now, I note that there are several questions that were placed in the Q&A function in the chat, which we welcome. We have responded to some of those questions directly. For those that we may not be able to, in the interest of time, rest assured, we will, and the responses will be shared to the email address to which your invitation would have been sent. Before we bring this webinar to a close, however, I would love to invite you, the audience, to share your feedback on today's proceedings by completing the webinar feedback survey, which can be accessed via the link which was placed in the chat. And I will see if I can also place the QR code in the chat if you're not able to access the link. While you do so, please allow me now to invite our final presenter, Dr. Heather Armstrong, the head of the Chronic Diseases and Injury Department at CARPHA, to give closing remarks and bring this webinar to a close. Thank you. It's been my pleasure being your moderator for today. Dr. Armstrong.
Thank you very much, Abigail, for a wonderful job you've done, and to our colleagues, partners, and stakeholders. As we wrap up today, we're not just ending a launch, but rather we're continuing in the important change in how we protect and support our children's health across the Caribbean. We now have the technical recommendations for the development of nutrition standards for Caribbean schools. And of course, we've also heard of many resources that PAHO provides that would help us to make a difference in terms of addressing pressing health problems such as childhood obesity and related diseases. And this moment matters because, yes, we have strong guidance, but because of the teamwork that has been displayed through the several presentations that have been made, where there's partnership between Ministry of Health and Education, regional groups, civil society, and other development partners who are all playing a part in helping us create the healthier schools where our children can learn, grow, and thrive. And our real success will be in us being able to put these ideas into practice, where we will see these standards being part of a national policy, when school food options improve, when stakeholders gain new skills, and most importantly, when our children's diets and health improves. So therefore now we want to be able to turn these recommendations into real enforceable standards and guidelines. We want to be able to support schools, vendors, and communities as they adopt healthier practices, be able to monitor progress, and of course, ensure accountability, which was stated as a key part of this process. And of course, keep building the partnerships that got us here. So in terms of pulling this launch to a close, I want to sincerely thank everyone who has helped make this happen, from the technical experts and policymakers to educators and advocates, and to those who have attended and listened and who are excited to be part of this change that we want to occur within our region. Your hard work will make a difference in terms of us making our environment healthier for our children.